this child cannot stand up. I mean, she's so sick. She cannot even stand up. And 90% of the time, she's just lethargic on the floor. And mom is concerned because this has got to be treated by rapid expansion in the mouth and whatnot. And I brought it up that you may want to check mold first.
My name is Michael Rubino. I'm on a personal mission to make sure you don't get sick inside your own home.
I knew there was something wrong. I'm just so relieved there's something that you can do about it.
Thank you for joining us with another episode of Never Been Sicker. I'm your host, Michael Rubino, and today's amazing special guest is Dr. Bahar Esmaili. Dr. Bahar, welcome. Thank you for taking time out of your busy day to be here with us all.
Thanks, Michael, for having me. I'm excited to share some information with your audience today.
So you are an amazing doctor. You also have amazing products. And so I would love for you to kind of share your side of the story, your journey so far that kind of led you down this path, and we can dive in.
Yeah. Well, Michael, my journey as a dentist had a couple of twists and turns, and nothing ever has gone the right direction when we have good intentions. We always come up with the roadblocks. So my journey, I've been a dentist for 15 years, took a U-turn right at the cusp of 10-year mark when I decided that dentistry didn't make sense at the state that I learned and practiced for 10 years, because it was all about fixing the teeth and it wasn't about addressing the body that hosts the teeth. And I knew all along that every generation of dentists is fixing the problem of the last generation. And there's more to the story. A body put together, that mouth, that set of teeth, and there's a nervous system that governs the formation, the integration. So long and the short of it is, I wanted to be specialized in airway TMJ. And 5 years ago, I decided to shift that direction and utilize all that energy towards finding out how the body came to being in the mouth and how it's impacting the body. And Michael, I tell you, just a bit for your audience without boring them, our mouth is a manifestation of the body. From the bacteria that grows in the mouth and what causes periodontal disease and cavities and the microbiome, which is exactly the replication of the gut, to the nervous system function, to the orientation of the upper lower jaw, to the neck, breathing disorders, physiology of the body maintaining itself, and how it's related to the immune system. I originally wanted to write a book with that title called If the Mouth Could Talk. And it could just literally show you how your body is falling apart and it manifests itself in the mouth. So if the dentist would look close enough in the mouth, every single thing here, from position of the teeth, the soft tissue, bacteria, microbiome, all of it, it shows what state body is functioning and how it's falling apart. So we can take that information and find out where that tip of iceberg, it's getting all that information and address it in the proper order. And everything for me boils down to one thing: how we breathe and how our autonomic nervous system is postured to represent that, which it gets exacerbated in the mouth, which is funny when I say this. I hope that by the end of this, I make it clear so somebody learns something new, because we're standing on 2 feet and we have to support our body for all of our function, most important of which is breathing on 2 feet. So the other end of our chain is right here in the mouth. So when that chain comes to closure, everything is just now stuck and cannot go outside of that. So body continues to torque and adapt and adjust at the expense of our nervous system function, immune function, name it.
I love that. And of course, we're talking about how we breathe. And if you've ever listened to me talk, I'm very vocal about what you breathe is really important as well. I wanted to bring something to your attention based upon what you said. I actually had bone cavitation surgery a couple of years ago because apparently the first dentist that removed my wisdom teeth didn't do it properly. And I started having some issues with my mouth. And because of that, there was actually, I guess, some bacteria where the ligaments were. And so they had to basically go back in and fill it back in and, perform this surgery to stop the bone and jawline essentially from decaying, which is really, really interesting. Just because you said, every generation of dentists is fixing another generation of dentists' problems. I am a real living example of that. So thank you for bringing that to light. I want to talk about, just we have never been sicker than we are today, right? And you just mentioned how you feel like the mouth is so vital. Can you please talk about how you're seeing this trajectory of illness and how the mouth and breathing play a role into that?
Well, one thing is for sure, Michael. Our bodies are not getting the right stimulation from environment. The environment is becoming more and more hostile, as you know it, in terms of giving us an opportunity to grow with the resistance. We're breaking down with it. Most important of which is formation of our skull. If you can see in my background, I have a skull in here because I truly believe that part of our face, which is right here, hasn't been completely done forming at birth. And one of the most important functionalities that grows our face in the proper direction, guiding the upper lower jaw in the right proper place for the teeth to erupt into, depends on how we breathe and how we're posturing our tongue. The two of them are correlated. Literally, the tongue posture, nasal breathing, what's forming the face, and how we swallow. So one of the biggest contributor to all of that is the stimulations from the environment. And I'm talking about not just breastfeeding and soft food, but that's definitely a great contributor to that, but also from the traumatic birth, from lack of proper breathing function, the posture, all of that contributes to faces getting smaller, jaws getting more retracted, and brains are getting bigger. So we're not, first of all, we can't get the right amount of oxygen to the brain properly. Draining toxicity, the biggest one of which are heavy metals and even mold, yes, clearing that from the brain, because how these bones are related play a huge role in how the spinal fluid clears the brain. And if there's lack of development in the skull bones in the face exist, that will contribute to lack of or improper flow of spinal fluid to the brain, clearing the toxins, clearing oxygen, which leads to the physiological changes in the pattern of breathing and functionality of the body. So that puts body into the state of fight, flight all the time, which drum rolls turns on inflammatory cycle. When you're breathing with the sympathetic nervous system, fight or flight on all the time, instead of using the diaphragm, we're using our chest. And when you're using your chest, that signals the body's immune system to turn on all the time. And that cycle of inflammation that is never turned off is now causing a lot of body issues, from digestion to the vagal tone to everything that has to do with the homeostasis, with the rest and digest is now halted. Imagine this is happening to our children. This is literally the epidemic that we're not talking about, called breathing disorder. The way we breathe. Because why nose? Why am I just constantly talking about nose? Because inherently, I know one truth and one fact that guarantees you a healthy life, a healthy, long life, is everything that is to support you breathing through your nose properly. The period, end of the story. Because our nose has several functions, most important of which is humidifying, filtering the air, mixing nitric oxide, calming the nervous system. When that mechanism is not working properly, that contributes to lack of growth, that contributes to lack of proper function, and low tongue posture, pain, dysfunction, and the cycle repeats itself. So trajectory of that is, bottom line, how you breathe determines your health. Lack of nasal breathing equates to some level of body dysfunction, and how you can handle that insult or that lack of proper function is individualized for every person to another. But I tell you, our kids' nutrition is getting worse. The amount of sunshine they're getting is getting worse. They're inhaling a lot more polluted indoor air. That's getting worse. All of those additive stress are already there. So, and body's ability to handle all of that is going less and less because they're becoming more and more mouth breathers. That combination becomes sicker and sicker and sicker children that basically have asthma and allergies. And we think, oh, they all do. They have crowded teeth. All kids do. That's normal. Not normal, it's common. We're normalizing something that's more common because now the state of level of health have dropped so low that every disease now is considered a new level of health.
Yeah, wow. It's like the new normal. Everybody wants to normalize everything that should not be normal, right?
No,
It's
there's
crazy.
nothing normal about all these kids being allergic to 20 food, and they're just highly medicated to keep their vitals, and they're not healthy. They're just super pumped up with meds.
I mean, when we look at it, I see all these autoimmune conditions. They're on the rise. Autism in children is on the rise. PANS and PANDAS in children is on the rise. neurodegenerative brain disorders on the rise. I mean, everything is on the rise. And you make a good point. It's about kind of going back to the simplistic issues that we deal with. I mean, clean water, clean air, clean food. These things are vital to the human being, but yet we've lost sight of these things. I mean, how much processed food are we eating? How much bottled water are we drinking and not drinking enough clean water, right?
Yep.
How many people are actually breathing clean air? Well, I can tell you, based upon the American Healthy Home Survey 1 and 2 that were done by the EPA and HUD, 35 of the 36 species of molds that they test for went up in prevalence over a span of 13 years. And this is between 2006 and 2019. So we're seeing that it's getting worse, right? And mold's just it's one biomarker to look at, really, in the microbiome scheme of things. If you have mold, you almost certainly have bacteria in your environment as well. And so if you have an overgrowth of mold and an overgrowth of bacteria, this is stuff that you're having to deal with, on top of probably a lot of microplastics in your environment, probably high VOCs and formaldehyde and all these other things that are already there, that have already gotten there because of just modern technology. And then everything coming together with the crappy food, the crappy water, the crappy air we're breathing, the environment in which we live, it's really created a recipe for disaster.
Yes.
What's interesting about the whole mouth breathing and nose breathing thing is I am a nose breather. The only time I don't breathe through my nose is when I'm sick and I literally can't breathe through my nose. But, it's my understanding that more and more people are unfortunately breathing through their mouth than ever before, which is obviously causing some of these issues. Any idea why that's happening, or any
Mouth
tips?
breathing is the epidemic, Michael. It's a multi-tier cause. If I wish I could tell you, it's one thing causing it, but our bodies are distorting in a way that is resorting to the secondary way of breathing, which is mouth. Because I'm going to equate mouth with chest breathing. Mouth and chest go together. You can't breathe through your nose. You can't breathe through your nose if you're using your chest. Breathing through the nose requires the breathing through the diaphragm. So you see how there's a lot of structure that supports the diaphragm, from pelvis to spine to foot position, and all of that ergonomically needs to be there to support the proper nasal breathing. When I say nasal breathing, it means properly breathing from the nose all the way to the diaphragm, about 6 to 8 breaths per minute. That's the good, proper nasal breathing with the right inhalation and followed by proper exhalation. The problem is inflammation cycle. And also, again, I want to just touch on a little bit on the skull, because that's really what I'm passionate about. And that's something that's not very much talked about. And that's really the focus of our products and systems in oral space development, because there are 22 bones in our head. Some of them are in our face, and some of them are in the back of the head, and some are in between. The part that's forming our face and sinuses and our nose and mouth is being a part of that. It's more like the storefront. That storefront is connected to what's in the back. So from the minute of conception, the way the baby's head is formed, the way they make it through the birth canal, traumatic birth, cesarean delivery, which, by the way, does disrupt the microbiome as well. Going through the birth canal, what's behind the face that's there before we have teeth and our faces are developed gets distorted. Now then we go from fully sensory humans to developing motor skills, rolling over, turning and crawling and all that, propelling from one side of the body to another, and gait cycles and walk. So when the skull is distorted from the get-go, then supporting that skull on top of spine and a pelvis, that becomes a distorted pattern as well. And the way the kids are walking is now distorted. Along with the soft diet that they've had, along with lack of breastfeeding and tongue low posture, tongue tightness, which is on the rise as well. They have not even learned how to swallow and breathe properly before they walked, and now they're uneven, and now they're walking with that same system. So that's another second layer of compensation. Now, going back to those skull bones, that's one end of a pump. There's a clear fluid that goes around the brain that gives it oxygen, remove toxicities from it, called cerebrospinal fluid. It's like a pump that goes around the brain. 125 milliliter of this fluid is produced by the brain every day so that the brain can get, the nutrients and toxicity removal. For this fluid to move, the movement of the skull bones with every breath needs to be coordinated with the diaphragm and pelvis. It's easier or less compensatory when we are not quite mobile on 2 feet, but it becomes that much more important when we stand on 2 feet. That the pelvis does its job and diaphragm does its job and nasal breathing is established, so that by diaphragmatic movement, this fluid gets squished in the bottom of the spine and it gets moved all the way to the top to circulate around the brain and then descends with every exhalation. If there's distortion in the skull and then secondarily to the pelvis, this pump is broken. Like this thing that I show all the time. Imagine the movement of the skull bones and the pelvis are coordinated like this. So like a sponge, they move this fluid around the brain. If there's distortion and lack of coordination, that movement is impeded, which means there's toxins built up on the brain. Lack of oxygen getting to the brain, physiological level of changes happening to the brain and blood barrier, which is why it changes the rate and depth of breathing. Now that same person, even if we teach them put their tongue at the roof of their mouth and force them to breathe through their nose, neurosensory wise, chemoreceptor wise, physiologically, they have altered to mouth breathing because their brain is not getting the oxygen. They force them to change the depth and rate of breathing to balance the gases in the blood. You see how that becomes orthopedic problem, gradually become a neurological problem and a physiological problem, and the cycle begins. Now, when that system, it's like, imagine, this probably makes more sense to people. That distortion that I explained in the skull and the face is like a drainage in the sink. If the sink is unplugged and it's just the water is rising and the faucet keep on dripping, that's your mold, that's your heavy metal toxicity, that's environmental toxicity that comes in. And there's literally a drainage in the sink. What is the sum of the two? The toxicity is constantly coming, they're not draining. They build up on the sink. They overflow to your floors. What do we have? Wet floors and destroyed floors. We have a system that's dysfunctional and sick. What does the medical system do? Let's go ahead and fix the floors. And once they're done, let's just redo the floors, right? You know that shutting down the faucet helps. And I know removing the drainage definitely helps. Not keep on mopping the floor. What do we see from a system that is not moving and is getting constantly bombarded with unclean air and water and toxicity from the environment? Inflammatory cycle that is on. Nothing good happens. That kid, that human is not in the state of sharing their gift with the world, being a productive member of society, because you're in survival. In survival, you can't care about other humans. You can't do your best forward, right? And that state of sickness perpetually, because these people can't exercise. And exercise is the most important thing we need to regenerate. The amount of benefit that have been linked to exercise is just mind-boggling. When in that state, exercise is the last thing on your mind. What do? Overcompensate. We're going back to the same food that made us sick to begin with, and adding more to that vicious cycle. But where do we stop that vicious cycle? I'm a huge believer of removing those toxic materials from the environment, getting more sunshine and all of that. But one of the most important things that has amplified results of that is working on the person's system first, making sure that they have ability to breathe nasally. They have the ability to use their diaphragm and their spine, and not putting so much pressure on that nervous system so that their nervous system dials more into the parasympathetic rather than stuck in a sympathetic mode, with the cytokines of inflammatory just through the roof, so that cortisol gets dialed down. Their body is more into rest and digest, and it can repair itself. That state amplifies all other things that I work with a lot of functional medicine doctors, and they focus on toxicity, they focus on microbiome, hormones, but all of those things will be heavily impacted with a system that does not properly move itself, spinal fluid, and it's unable to respire and breathe properly. So this is where I get to get really passionate about what I do complements and basically goes a long way with what everybody else is trying to address in a much shorter period of time. And I think what I also think that a lot of doctors that treat the breathing disorder need to know, what can we do to reduce the inflammation from the environment? And mold and heavy metal have been on top of my list, treating a lot of patients for breathing disorder, because at the same time, when we're trying to holistically treat a patient, it just makes sense to give them better nutrition, better environment, cleaner air to breathe, more sunshine, better circadian rhythm, So it's a collaborative effort, and in my opinion, a lot cheaper, a lot more effective, a lot more in line with body's functionality than pumping them up with medications and surgeries and procedures. So that's in a nutshell correlation of what you ask. How is that going to affect? A lot. It goes a long way if we can get them breathing better.
I could see that. I could see that clearly. And it sounds like, this has been a big missing piece for us because, of course I can help people turn off the faucet, right? The faucet is being this toxic environment that's constantly invading their body with every breath that they take 20,000 times per day. And of course, you have doctors that are putting people on detox programs and doing all these amazing things, which obviously are also needed. But if you don't also learn how to breathe better at the same time, it sounds like everything else just takes longer.
It does. It does. And yeah, inflammation from outside in. I treat the narrow passage of airway. I treat the uncoordination between the skull and the pelvis and the spine, getting movement back into the body. That's what we do, especially with the tongue posture and proper diaphragmatic breathing. But it tremendously helps getting a body a leg up by removing that toxicity constantly coming in, that inflammation that just is on all the time, especially in the mucus, tonsils that are just enlarged. Mouth breathing leads to tonsillar enlargement. Environmental allergens and mold also contribute to it. So even the physicality of the airway itself is connected to the two together. You could have a small dysfunctional airway that's resistive and it's not allowing your passive breathing to happen properly. But on top of that, having inflammation in the mucus and the lining of the airway also tremendously change the trajectory of how the patient's immune system is functioning. It's all of it, all of it at once. And I don't think that there's one approach to health. Health is a three-legged stool. There is biochemical, environmental aspect, which is a lot of things what you have seen addressed in what you do, and a lot of functional medicines address. The food we eat, the air we breathe, and also the chemicals that our bodies are exposed to, and how our hormone system, immune system puts up a response. That's all physical and biochemical. And then we have the orthopedics, neurology, and physical aspect, which is what I do, putting the nerves and the bones and things in the right place so the brain perceives safety from just the proper alignment. And then we have the mental spiritual aspect that's impacted by both, and in fact impact both of them. All three levels will produce stressors into the system, all three. And all three have a potential to relieve the body from stressors. Better eating habits, better breathing habits, better environmental, mental, spiritual practices, all of them put positive back into the resilience of the body. So I think even if there's stressors in life, that is inevitable. Like we know that work and life environment stressors inevitably will be there. Like right now, the election is putting a lot of stress on most folks. And that is part of life. Living in a higher elevation puts orthopedic stress on the body just from the mechanical breathing. It's so much easier to breathe in Florida than it is to Colorado, 6,000 elevation where I live, just by barometric pressure alone. That stressor will be there. What can I do to reduce other levels of stressors? How can we bring the body back to the same homeostatic that it's trying to achieve at such an expansive rate by putting more back into its adaptive capacity bank? And the question is always, what is the best bang for the buck? I would like to share a story of a patient, a 12-year-old. I've not seen the patient. I've only seen records, and I see patients remotely all over the world. And the concern for this 12-year-old was that she has a severe case of a retruded lower jaw. The lower jaw is far back into her airway, posture distortion in her cranium, which neurologically impacts her, neck problems, breathing issues, all of those I admit she has. She's no different than all the other 12-year-olds that I've treated, including my own child. But this child cannot stand up. I mean, she's so sick. She cannot even stand up. And 90% of the time, she's just lethargic on the floor. And mom is concerned because this has got to be treated by rapid expansion in the mouth and whatnot. And I brought it up that you may want to check mold first, because this is too much sickness for the evidence doesn't match the crime. If this was just a purely breathing issue, the immune system's response is a lot worse than it would have been. There is no adaptive capacity, zero. And this child cannot contribute to schoolwork, studying, spiritual practice, nothing. She can't even eat majority of food, her inflammation is so on. And she took it and tested. And lo and behold, it was the mold. And it was bad before where they moved and then in the new house. And they spent 3 months cleaning up the house, getting detoxification program, and the child's demeanor, health, 90% improved. Without changing much of anything at all in her orthopedics, her immune system rebounded itself. So now she can actually do a lot better, more practices, and she can eat better, and she can get into the exercises I need her to do and wear the appliances, what have you. The fact is, the biggest bang for the buck for that person was addressing a lot of that toxicity issues. And we lose sight of that because we only see things in our own silo. I try to see where is the biggest drop from the faucet for every patient that needs to be shut down first, and where is the drainage for that patient that needs to be removed, because the sum of two will yield less work on the floors. That's the biggest question at the end of the day. And that's one that doesn't get answered because most of us, like you asked me to come on this podcast, because I'm going to bring that perspective that breathing a clean air, definitely, and I've seen it multiple times over. It's so much so that's now on top of my list. If I see sinusitis, I see congestion in the sinuses, polypi tissues, or completely filled up sinuses, go for mold. Check it, because that will completely dial down your sympathetic, dial it up so much that a lot of things we're trying to do is like building a house when there's blazing fire going on. So that's always on top of my list. But at the same token, I encourage a lot of functional medicines that work on supplements and hormones and trying to get the body detox. It totally helps if they use their nose to breathe, because nose is the natural filter for your entire body. The gas nitric oxide, which has had so many benefits, so many health benefits already been established, from lowering the blood pressure to immune health to removing and killing a lot of pathogens, including probably even some mycotoxins from mold, is in fact produced when the nitric oxide is mixed with the air we breathe, as far as humidifying, slowing it down, and warming the air. And if you're breathing through your nose, a lot of those would be less issue. So can we find a common ground where we are not focusing on one aspect and completely forgetting the other, and looking at the person as a whole to see how did they get there? How did they get such a poor score of health? And how can we get them off the medications that's maintaining their health? And that's the podcast I started doing, Healthy, Not Highly Medicated. My goal is to ding as many medications off their list and, preventing them from getting a lot of unnecessary surgeries as possible by getting the body a chance to regain its homeostatic the way it was meant to, holistically and easily.
I love that. Yeah. I mean, you said so many good things in that segment there. First off, just identifying the fact that environmental exposures are at the top of your list. Obviously, you had to have seen people be exposed, and you've seen the effects that it had on them. And so thank you for recognizing that, because, so many people out there, they skip over it, they skip by it, and that allows people to stay sick, right? The other thing that you said that really resonated with me is just like, you want to get people off medications, right? Because our medical system is really designed to put people on medications with no real plan to get off those medications, right? And so I think those are two things that, are really powerful, and I really appreciate you for. So anyone who's listening now probably has a lot of questions regarding, okay, we've got this. Breathing right is definitely a big part of this, health transformation process. They understand exposure to toxins and mold and bacteria in our homes, no good. We've got tools to address that. I am deathly curious. How does one go from mouth breathing to nose breathing? And I'm sure that there are levels to this, if I had to guess. Like, I'm already a nose breather and not a mouth breather, but how do I elevate my breathing further?
You know what, Michael? I'm curious to see how good of a nose breather you are too. So do me a favor. I want you to just close your mouth and put your tongue at the roof of your mouth. And I want you to take one nice deep breath for me. Take a nice deep breath. Okay, and take one more deep breath. Okay. As you're doing that, and I'm watching you, you're using your shoulders and you elevate your chest like this to breathe. So this tells me When your tongue, for nasal breathing, proper nasal breathing, tongue has to be there. It's a non-negotiable at the roof of the mouth, with the tip of the tongue behind the two front teeth and the body of the tongue resting at the roof of the mouth. Otherwise, you're not an effective nasal breather. The reason for that is the fascia that is connected to the tongue and the neck right here, connected to the diaphragm all the way down. It's all synced up and coordinated with activation of diaphragm. So when I have you put your tongue at the roof of the mouth and I have you breathe, and the fact that you're using your chest and your shoulders to move your rib cage, that tells me possibly your diaphragm is not able to coordinate with your nose to breathe. And that is diagnostic enough to know that, do I need to just shut down my mouth and tape to be able to breathe? The domino effect and the quantum of things that goes behind the why of that, from a neurological, physiological, and yes, orthopedics, it's something that we do better than any, because when every patient mouth breathe for a different reason. Some could have a physiological, gas exchange issues, meaning that their body's sensitivity to retention of the CO2, which is the gas we exhale, is too little. So they have to dump a lot of it out because they've been a chronic mouth breather and their body's sensitivity to CO2 is not high. So to change that, we need to, the focus is to change that pH and biochemistry of the gases. That contributes to a lot of low threshold in arousal in sleep, so they wake up too often. Some have a narrow airway to begin with, meaning that their faces didn't develop forward because the tongue fascia was restricted. And tongue is really the architect that forms the mouth, position the jaws in a more forward position. That's where our faces are supposed to grow our sinuses and eyeballs, so that we can be more mobile, more sophisticated with better breathing. When the tongue is lazy and tethered and attached to the floor of the mouth, called tongue tie. Even breastfeeding, it's not just for applying nutrition to the body. Breastfeeding is meant to pull the face forward. And if for that to happen, also tongue needs to be at the roof. So tongue tightness, which we're still trying to find out why we have such a huge case of tongue ties, tethered oral tissue, lip and tongue tie, which prevents the kids from properly breastfeeding and growing their face and directing their nervous system that way from the beginning. We're not going to experiment on pregnant women to know, but tongue tie is the new cleft palate of our generation. And so for a person to properly nasal breathe, their mouth needs to grow. And if the tongue has not been able to do that, that's the number one on the list that needs to be checked as to why. Does the tongue have the tonicity? Is it too tight? Does it have enough room? Was the body able to give the tongue initial step to go where it needs to go, and it didn't? That's the first thing. Second is the structure that support that. The entire cranium, the skull, in coordination with the spine, needs to work properly together for that nasal breathing to happen. The end point of the spine, the bottom of the spine, is our pelvis. Where the pelvis is oriented and how we are coordinating our bottom part to the top part as we walk through space create a dysfunctional breathing. So that dysfunctional walking, propelling through space, and breathing all contributes to what becomes a dysfunctional breath from, one side of the body propelling from one side to another becomes an issue, and a whole host of things. Again, to boil it down to one thing, nose to diaphragm requires pelvis and diaphragm to be in a parallel position, meaning the rib cage needs to support that. Neck needs to be on top of the spine. Pretty much skull needs to be on top of the cervical spine, which is the top of our spine. And the tongue needs to stay at the roof of the mouth. So if I have encouraged your audience right now, roll your shoulders back, sit up nice and tall. Okay. Roll your shoulders down and back. And put your tongue at the roof of your mouth and pull your chin back and put your head right on top of the spine. That's a proper posture. Now, if you continue to breathe in that position for the next minute and slow down your breathing, meaning 4 seconds in and 4 seconds out, you figure out very quickly that after about 10 or 15 seconds, you have to stop and open your mouth and put your head over here, because your body's sensitivity to retention of CO2, the way of getting the air in and out, it's suffocating. So what do people do? Go back to mouth breathing with the head in a forward posture, slouched shoulders, rib cage goes out, pelvis goes back, shifting of all the structures, tongue goes low, and they continue mouth breathing. So when we are trying to pay attention to our breath, we become very clear. I cannot take a deep breath and hold it and breathe out properly, because that mechanics, chemistry, physiology, all of that has been well established. To break that, they need to come see somebody like me. When I look at their skull and look at their tongue posture and look at their body posture and where's their diaphragm? Why are they not able to properly breathe? So we fix that neurology and mechanic. And as we do that, the ability of the body to neurologically and biochemically fixing itself back into the proper breathing is much more likely, because if you have the proper mechanics to breathe, now you can work on increasing your sensitivity to CO2, which is huge for nasal breathing. Did you know that the amount of time that you should be able to hold your breath and not have the urge to dump the CO2 out and take the next breath should be about 45 seconds. Average kids not get it. Average kids cannot do it more than 9 seconds. 9 seconds and the brain is like, nope, you got to open that mouth and get that air out, because their body is not sensitive to retention. Now, low sensitivity to CO2, inflammatory cycle on, immune system function down. Now, even the trace amount of environmental issues will be impacting the body, because the immune system, instead of doing what it's supposed to do, it's constantly turned on in response to a malfunction. And so body is using its resources to do what it's not meant to do, and it doesn't have what it needs to do what it's supposed to do, protect itself against toxins and environmental pathogens. These kids get more sick more often because their body's just too busy fighting its own self with an inflammation. Body inflame, that's what inflammation is. And to turn that off, it takes a team. And I'm all huge about getting them that leg, getting that immune system, the good proper supportive nutrition, removing whatever is that's triggering that inflammation out of their system, whether it being, crappy food that they're eating, whether it being the air they're breathing or the bed they're sleeping in, or even the town they live in. Some folks do better at sea level than they do in elevation. But that total picture of health creation is never one size fit all. And it's every individual for themselves, whatever genetic card they've been handed over, whatever the environment provided them, and whatever they could put up against the environmental offense and stressors that sums up and say how sick or healthy they are. But you're right on one thing on your podcast. We've never been sicker than we are now. And a lot of that boils down to our body's state of functionality to protect itself is losing. We do not have what it takes to be humans. It's so hard to be human this day and age. We're de-evolutionizing so fast. Not trying to be Debbie Downer here, but trying to
It's true.
take the obvious, the pink elephant, the modernization was meant to get us sicker. I mean, look at labels on the food. Everything that you're reading, you just get that phone. I like the kids to challenge them. They're like, well, can I have this and can I have that? Sure, you can have it when you go to the supermarket, which barely there's any food in the supermarket. Get your finger and put your finger on the label. Whatever that comes after your finger is not food. And start reading that, because they confuse you by giving you the organic this and organic that, but they put the natural flavors at the very end, hoping that you don't see it. And there's xanthan gum, and there's a couple other things. And I read number 40. Okay, so we're not eating food. That's a source of inflammation that's inevitable. Finding real sourced food that was nourished by the sunshine, there's electricity to charge our system, it's hard. That's getting harder and harder. And we're getting more fed and less nourished. And then on top of that, we're living indoor with less sunshine and less surface ground, less human contact, and less verbal communication. Our mental spirituals are starting to drain more and more. Our spiritualities are suffering. And on top of that, the way we are breathing, which is the sum of it all, is getting more dysfunctional. So I made it my personal journey and mission to not just raise awareness about what I do, which I absolutely love. I love developing the craniofacial art appliances, the Vivos DNA appliances. I've been using them for almost nearly 4 years, exclusively. Hundreds of patients' lives I've changed by allowing their bodies to go back and stimulate their bodies to the original state of how it was, opening up the sutures in their mouth, which inevitably impacts the sutures in their skull, allowing their mouth to be in coordination with their body, giving their tongue a chance to go to the roof of the mouth, and changing the trajectory of how they breathe. And I work with a team of doctors, from orthopedists, chiropractors, and functional medicines to myofascial therapists, to put that system together. But that's only the orthopedic and neurology end of things at best, And then addressing other things in the food and environmental levels, and getting them and helping them understand, like the patient I explained to you, helping them understand that if you're living in a toxic world, no amount of nasal breathing is going to fix that. Like your body is fighting a bigger fight than it's there. If you're living in a toxic, emotionally draining environment, you need to address that. Those are the things that you have control over. And among many of those, like I said, I was really excited to hear that, what you do with mold, because mold has been on my number one on my list. And I see more of it even in Colorado and heavy metals and mold have been devastating the patient's respiration, not just breathing, but respiration, which means how that oxygen gets to the cell, and the cell wall itself gets heavily impacted by the effect of mold toxicity. So I really appreciate the work of people like you. And it's just always refreshing to go out there and see that somebody have done a better job, so that I can send patients to and be like, let's get that started. You have no idea how many times a week I tell somebody about mold, how many times a week I tell somebody about heavy metal, and how little attention is being paid to both. Yeah.
Totally agree. Well, I'm really excited to connect with you offline and share some resources with you for your patients. Now that we're all convinced that we need this, because clearly I've got to sit better, I've got to breathe better, even though I'm a nose breather. I'm not really a nose breather. So how do we find you? How do we work with you?
Well, if you guys want to find more information about what I just presented, the best place is my YouTube channel on my website. I put videos up there for patients, airwayarchitect.com. And if you want to find a provider, you want to find a team, drop me a message in there and find you somebody that can help you. But if you want to learn about the treatments I do and the modalities I use, vivos.com. Vivos is the company that pioneered the oral appliance therapy that non-invasively, non-pharmaceutically, and non-surgically treat the airway disorder and basically address the breathing disorder. And we're the only product, and it just makes me excited to even say that, this is the only oral appliance in the market that has been FDA cleared for treatment of mild to severe obstructive sleep apnea, which is the end result of all breathing disorders. And we are the only company that got the clearance for the treatment of obstructive sleep apnea for children. So FDA is finally admitted that large tonsils in children, which was removing them, was the only mode of treatment for OSA treatment in children, in fact is a breathing disorder. And to treat it, we got to treat them. Exactly. This is like, finally they admitted that water is wet. But we're just at the beginning. Michael, we're just starting. And the fact is, I want people to know there's hope and there is choices that they can make every day to gain the control of their health. And nobody's going to come and knock on their door and say, you got to change the way you eat. You got to change the way you sleep. You got to change the way you breathe. Nobody's going to show up. You only can do that. You only can make that decision for yourself. And I'm not saying that medical system is wrong or that I've got everything. No, medical system need to show up when somebody has a heart attack. That's not a time for me to show them how to breathe properly, okay? Because when I hear the sirens in the background, the ambulances, I tell my kids, somebody finally stopped breathing and medical system showed up. That's when they should show up. And that's when they wait to show up. But the fact is, if that's the mode of operation every day, then that's wrong. So yes, we have medical system that you alluded is banking on people staying sick and medicated. And then there's people that are doing their best, getting people off the medications, getting them better, healthier life, getting them off of those sickness management train track that is just never stopping. Every medication has 3 side effects and causing 3 other problems. For every one of them, there's another medication. Nothing is ever going to be addressed at the root cause. And to me, the root cause, the mother of all, is how you breathe. And if you're not breathing properly, your body is just at some level or another, immunologically, neurologically, chemically, it's just falling apart at some point or another. So yes, I would love to show you and your audience what's possible. But for now, just know that there's a lot of hope. I have treated some of the sickest people. And in a short period of time, we've been able to get them off of CPAP. We've been able to get them off the asthma medications, a lot of ADHD medications for children, bedwetting.
Wow. It's amazing.
Learning disability. It's amazing. Amazing what's possible when you can breathe.
Amazing what's possible when you can breathe. I love that. Dr. Bahar, I want to thank you so much for taking time out of your busy day to be here with us and share this amazing wealth of information that you have today. You've already kind of told people where to go. We'll make sure we copy those in the show notes as well. And just want to thank you again and hope to see you soon.
Thank you so much, Michael. I enjoyed having my time and sharing my information with you.